Start, sir.
Bismillahirrahmanirrahim. As you know, my name is Dr. Iqbal. I'm Associate Professor of Microbiology. And we are going to discuss another topic of viruses. We discussed the general features of viruses earlier on. So today we'll discuss measles, mumps, and rubella. These are the three important viruses. Mumps and measles are considered to be the diseases of childhood. And the rubella is significant because it causes congenital abnormalities in early pregnancy. So first we'll discuss measles. The measles, as you know, it's a virus which belongs to the Myxovirus family. The viruses are classified as families, as we discussed earlier. The family consists of the four viruses like measles, mumps, parainfluenza virus, and respiratory syncytial virus. The genome of these viruses is a single piece of single-stranded RNA, and it is morphologically helical. The nucleocapsid is helical, and it is enveloped, containing a envelope which is composed of lipoproteins. So as I told you last time, that the RNA viruses, that the viruses are either RNA or DNA, and again some of the RNA, all of the RNA viruses are single-stranded, but there are few RNA viruses which are double-stranded, and in this case the virus is single-stranded helical virus. Now the helix, it contains a helix in which the nucleus or the nucleic acid, the virus RNA is found. Then again, the important point about the proteins which protrude from the envelope. The virus contains spikes, and these are made up of, these are heme agglutinins. Their characteristic feature is that they cause heme agglutination when RBCs are added. And they also contain an enzyme which is neuraminidase. And they also, these spikes, they have heme agglutinin, neuraminidase, and they have the capacity or capability of fusion of the cells through their fusion proteins. And some of these proteins, they also cause hemolysis also. So these are the characteristics of the viruses of the Myxovirus, and the genome is not infectious. This again is a repetition. This virus has two types of envelopes, spikes, heme agglutinins, and this heme agglutinins is the antigen against which antibodies are produced, and it is antigenic and also causes cell fusion. And for the viruses, humans are the natural hosts. So the measles disease occurs in humans only. So these are host factors for measles, that it causes disease in the childhood from 6 months to 3 years, even up to 10 years. And incidence is equal in both sexes. And after having the disease, immunity is lifelong. And the malnourished children are more susceptible or vulnerable, and especially those who are vitamin A deficient. So the vitamin A deficiency is one of the most important cause of vulnerability. Environmental factors include winter season, overcrowding, and transmission is by droplet infection, and the virus is shed 4 days before and 4 days after the rash, and the incubation period is 7 days. Most of the viruses, they have the incubation period of 7 to 10 days. Humans are the only natural hosts. Other animals such as monkeys, dogs, and mice are experimentally infected. We come to the pathogenesis and the pathology. As I told you, the infection is spread through respiratory tract by droplet infection, and the virus multiplies locally, then spreads to the regional lymphoid tissue, and where further multiplication can occur. Then primary viremia disseminate the virus, and which then replicates in the reticuloendothelial system. Finally, a secondary viremia seeds the epithelial surface of the body, including the skin, respiratory tract, and conjunctiva, where focal replication occurs. Measles replicates in certain lymphocytes which aid in dissemination throughout the body. So, one of the causes of dissemination is through the lymphocytes. All of these events, they occur in the incubation period, typically which lasts 8 to 15 days, and sometimes it may last up to 3 weeks in adults. Then the most characteristic feature of the measles is maculopapular rash, which appears about the 14th day of the disease, and it occurs just as circulating antibodies are detectable, and viremia disappears when the antibodies appear and the fever falls. The patients are contagious during prodromal phase, which is 2 to 4 days, and the first 2 to 4 days of rash, when the virus presents in tears, nasal and throat secretions, urine, and in the blood. Maculopapular rash develops within the interaction of the immune. Now this cause of the maculopapular rash is the attack of cytotoxic T cells to the virus-infected cells in the vascular endothelium cells in the skin. This causes the maculopapular rash. And it is thought that it is one of the causes of the maculopapular rash is antibody-mediated vasculitis, which play an important role. Now this is a maculopapular rash of the typical measles, and it occurs first on the face and then comes downwards to the extremities and the limbs. So measles also causes CNS, which is the complication of the measles, and it causes symptomatic encephalitis, which develops in 1 in 1,000 cases or 1 in 100,000 cases. So infectious virus is rarely recovered, and it is thought to be an autoimmune reaction. So the progressive measles inclusion bodies, they are cause of encephalitis, and it is thought that it is the defective cell-mediated immunity which is the cause of progressive measles. Actively replicating virus present in the brain in this usually is fatal form of the disease. So measles is fatal when it causes the complication. So there is a diagram which shows the incubation period and the early prodromal phase. So the clinical features include prodromal stage, eruptive stage, and post-measles stage. In early, there are 3 C's: cough, coryza, and conjunctivitis. These are the cardinal signs of measles. And then Koplik spots appear in the buccal mucosa and fever. And ultimately, the generalized maculopapular rash appears on the body. The Koplik spots are pathognomic of the measles, and they are actually the fusion of the multinucleated giant cells, which are actually they are bright red lesion with a white central dot located on the buccal mucosa opposite to the lower molar. Spots contain multinucleated giant cells and viral antigens, and they appear slightly before the rash appears. So Koplik spots are the pathognomic and one of the cardinal signs of measles. This is the picture of the Koplik spots. So after having the disease, the patient has lifelong immunity, and this is due to the IgG antibody, which has a role, but the cell-mediated immune response is also important. In measles, the cell-mediated immune response is suppressed against intracellular microorganisms like Mycobacterium tuberculosis. So the PPT or the tuberculin test, this sometimes becomes negative because of the suppression of the cell-mediated immune response. And this suppression is due to they say the virus, it gets attached to the CD46, which is the receptor on the macrophage, and the macrophage ultimately stops producing interleukin-12, and this is the cause of suppression of the cell-mediated immunity. So these are complications of the measles: diarrhea, pneumonia, whether it is secondary bacterial pneumonia or viral pneumonia, orchitis media, and sometimes when the CNS is involved, convulsions. And one of the most important complication is subacute sclerosing panencephalitis, and this SSPE occurs after many years. Pulmonary complications, there are more than 90% of the measles-related deaths. Viral pneumonia develops in 3 to 15% of the adults with measles, and this viral pneumonia is rarely fatal. Pneumonia, otitis media occurs in 5 to 9% of the cases. Primary measles, in which giant cell pneumonia and secondary bacterial pneumonia occurs, and these are life-threatening complications, and they occur in 20 to 80% of the people. So pneumonia is a significant complication of the measles. And as I told you, the CS complications, the most serious is post-infectious encephalomyelitis, and it is an autoimmune response to myelin protein of the So mortality rate in encephalitis is 10 to 20%, and majority of the survivors they developed neurological sequelae. So there are some sort of complications after survival or after convalescence. One of the complications is acute encephalitis, which occurs at a rate of 1 per 1,000 cases of measles. The mortality rate of encephalitis is 10 to 20%, and permanent sequelae like deafness and mental retardation in 40% of the cases can occur. Now, these are the complications. If measles occurs in pregnancy, it is more dangerous. It may cause stillbirth, unlike Rubella syndrome, which causes congenital abnormalities. So, it is very much dangerous when the measles occurs in early pregnancy. So, the post-measles complication is the subacute sclerosing panencephalitis. It's a rare complication. It occurs in 1 in 1,000 to 1 in 100,000 cases. And it begins insidiously 5 to 15 years after the measles infection, and it is characterized by progressive mental deterioration, involuntary movements, muscle rigidity, and coma. So what is the lab diagnosis of the measles? So lab diagnosis is modified, and atypical cases is a greater than 4-fold rise in antibody titer. The modified and typical cases are those cases in which full-fledged clinical symptoms they do not appear, and patient is subclinical or asymptomatic. And in this case, antibody titer is important, and the antibody titer must be of 4-fold rise when it is taken between the 2 weeks or 10 days interval. The most common or the most important lab diagnosis is the detection of the virus by means of real-time PCR. For all the viruses, the PCR is the most sensitive and specific test. So, what are the samples which are taken? The nasopharyngeal, conjunctival swab, blood samples, respiratory secretions, and urine from the patient in febrile period. These are taken, and the virus can also be isolated in a reference lab. So serology, as I told you, for the antibody detection, 4-fold rise between acute phase and convalescent phase is important. Measles specific IgM in a single serum is important. If the patient has had the disease within a week, if the IgM antibodies are present, it is significant, and it is the acute. It signifies acute infection, and the specimen drawn between 1 and 2 weeks after the onset of the rash. So after the 2 weeks period, if IgM is raised, it is indicative of acute infection. Measles can also be detected, and measles antigens can be detected directly in epithelial cells from respiratory secretions, the nasopharynx, conjunctiva, and urine. And antibodies to nucleoproteins are useful, the most abundant viral proteins in infected cells. In SSPE, the SSPE, subsclerosing panencephalitis, is diagnosed by finding antibodies in CSF, or direct demonstration of the viral antigen by immunofluorescence techniques in nasopharyngeal aspirate or PCR. These are the three methods which help diagnose the SSPE. Then again, ELISA is an important method of detecting antibodies. One of the method of viral infections which have heme agglutinins on their surface, the method is known as heme agglutination inhibition antibody test, in which the patient's serum is taken and it is reacted with known viral antigen, and if the serum has antibody, it caps the heme agglutinins, and it is this test which is diagnostic for those viruses which have heme agglutinins on their surface, like measles virus. So the WHO strategy for control and prevention of measles is catch up, keep up, and follow up. There is no antiviral treatment actually. Vitamin A is given to the malnourished or those who are deficient with vitamin A, and the prevention is a combination vaccine of measles, mumps, and rubella virus in combination with live. This vaccine is live attenuated. There are two types of vaccines. One contains measles and rubella. It is live attenuated rubella, and the other is in combination live attenuated rubella and mumps, MMR, which is common. It is in WHO protocol. So MMR vaccine is the vaccine which is given in the 15 months of age. So since these vaccines are live, they have some contraindications. They cannot be given to immunocompromised patients, those who are allergic, or in early pregnancy, because they can revert, and they are also contraindicated in HIV/AIDS patients, or when there has been given immunoglobulins. So in early prodromal phase, immunoglobulin can also be given to the patient if the patient is malnourished or deficient. So this was all about measles virus. The second is the mumps. So the name of the mumps comes from the British word to mump, that is the grimace or grin. Mumps means grimace or grin, and this is due to the appearance of the patient as a result of parotid gland swelling seems to be in grin. So this is a patient with a parotid swelling, and it is the swelling of the unilateral or sometimes bilateral parotid glands. The mumps virus is also an RNA virus, and it's part of the Myxovirus family. Mumps is acute contagious disease, and it causes non-suppurative enlargement of one or both salivary glands. It also causes swelling of the testis, the ovary, and the pancreas. It is considered a mild childhood disease, but it also causes disease in adults as a complication of meningitis and orchitis. Mumps also has lifelong immunity. Once the patient gets the disease, he or she becomes immune. So what are the environmental factors? Again, winter and spring season, and mode of transmission is again the droplet infection. Age of the patient depends 5 to 15 years, and girls are more common. Incubation period depends 2 to 3 weeks or 18 to 21 days. This is the incubation period. So, mumps causes basically the swelling of the glands, and especially the parotid gland swelling. It also causes swelling or infection of the ovaries, which is known as oophorytis, pancreatitis, earache, and it causes infection of the testis, which is known as orchitis. This is a diagram which shows various parts of the or organs which are infected with the mumps. The clinical features, they are, the incubation period is 2 to 4 weeks, but typically 14 to 18 days. 1/3 of the cases, they appear subclinical, and in younger than 2 years, sometimes the patient is asymptomatic. The characteristic swelling of the salivary gland occurs in 50% of the patients. Prodromal period of malaise and anorexia is followed by rapid enlargement of parotid and other salivary glands. The swelling may be confined to one parotid gland, or one gland may be enlarged several days before the other gland. And sometimes both glands are involved. And the gland enlargement is associated with pain, especially when the patient takes citrus fluids. The CNS involvement also occurs in 30% of the cases. And the CNS involvement is in the absence of parotitis. Mumps also may cause aseptic meningitis, where the viruses, when caused, they are known as aseptic meningitis, where the meningitis is due to the infection of the bacteria that is pyogenic. Now in this case, one of the causes of aseptic meningitis is mumps. The other viruses, Koplik virus and echovirus, they also cause aseptic meningitis. And this is more common in males than in females. Cases of mumps, meningitis and meningoencephalitis resolve without sequelae, and unilateral deafness occurs in 5 in 100,000 cases. Mortality rate in mumps encephalitis is 10%. So pathogenesis and immunity is that the humans are only natural hosts for the mumps. Primary replication occurs in nasal and respiratory tract epithelial cells. Then the virus spreads and causes infection of salivary gland and other major organ systems. Meningoencephalitis usually occurs in 5 to 7 days after inflammation of the salivary glands. Meningitis reported in 15% and encephalitis in fewer than 0.3% of cases. Virus is shed in saliva from about 3 days before to 9 days